Good day, everyone. Let me just start by thanking all of you for your attendance. I understand that we are all in busy times, but thank you for your attendance. It's appreciated. And I'd like to welcome all of you. Let's just commence, colleagues and others, with a moment's silence, please. There are people who have passed on. Thank you. The agenda is in front of us. The first item, opening and welcome, which I've done. Attendance and apologies. I know we have the apology from Honorable Rogers, who has arranged substitution with the Honorable Bapti, who is here. Are there any other apologies, Cabo?
Yes, ma'am. An apology that we have is Honorable Kaula that no, he'll be doubling is also with education and with us as well.
Okay, fine. Right.
Chair, education is already finished. Thanks, Kaul.
Thanks, Honorable Kaula. I saw you there on the screen. Thank you, Honorable Kaula. Okay.
Honorable Chair, I have a bit of a challenge with my network, so I'll be coming on and off.
Okay, thanks, Honorable Kele. But as usual, you are here and it's appreciated. We'd also like to acknowledge the attendance, I think, of the MEC. I did see an indication that she was here, so thank you very much, Honorable MEC. Item 3 on the agenda is constitution of the meeting. This meeting is duly constituted. It's the meeting of SCOPA, the follow-up hearings with the Department of Health, where we will take responses to the resolutions that were adopted by the House last year. Okay. Item 4, confirmation and adoption of the agenda. Can I have a mover and seconder for this agenda, please?
Honorable Kele moves, Chair.
Thank you, Honorable Kele, moving. A seconder, please.
Honorable
I
Kulu.
second, Chair.
No. Thanks, Honorable Kulu and Honorable Shinga, who have seconded. Then, without further ado, let us then go to item 5. Honorable MEC, before we hand over to you to make some few remarks, I'd like your accounting officer, as well as any others who might be speaking in the meeting, to take an oath or affirmation to speak the truth.
Good day, Chair.
Thank you, Chair.
Sorry.
Yes. HOD will lead and indicate who will be speaking in the meeting, Chair. Thank you.
Thank you very much, Honorable MEC. After they take the oath of affirmation, we'd appreciate it if you could give us some remarks and then hand over to them. HOD?
Good afternoon, Chair. Good afternoon to the honorable members. MEC, good afternoon. I swear I'm going to speak the truth and nothing but the truth, so help me God. The CFO will speak, and Mr. Tami Ndlovu will also speak. I would ask them to also take the oath.
Okay, CFO and then Mr. Ndlovu. CFO?
I'm trying to check on the, sorry, Chair, I'm trying to check on the list of people that have joined. I don't see both of them, but I think they joined initially. I don't know what has happened. I'm not seeing both of them right now, Chair. There's CFO joining now. CFO, can you hear me?
CFO?
Yes, I can hear you.
Okay, so thank you. Can you take the oath or affirmation to speak the truth, please?
I promise to speak the truth and only the truth. As thank you, God.
Thank you. I think Mr. Ndlovu, is he here? Dr. Shezi? Dr. Shabalala?
I've seen him join, Chair.
Yes, thanks, Chair. I promise to speak the truth and only the truth. Thanks so much.
Thank you very much. Okay, so having got that out of the way, let me then hand over to the Honorable MEC to make a few opening remarks, and then she will hand over to you for the presentation of the report. Also, if you could flight your presentation, it would be helpful. Honorable MEC, thank you very much for coming into the hearing. We know you are very busy, so it is appreciated.
Thank you very much, Chair. Good morning to you. Good morning to all the members in the meeting. Chair, we really appreciate being part of this meeting. I might not be able to sit, Chair, throughout the meeting as I'm in a different competing meeting, but I will try to sit at least for the first hour of the meeting, Chair, so that we get a sense of the issues that are being raised by members. Chairperson, like you said, my presentation or my comments will be quite short when it comes to SCOPA, but I did want to indicate that the department, Chair, continues to be underfunded, as is the sector of health. Therefore, our financial challenges will continue to be a challenge. Of course, we're not raising this to be crybabies. We do work with what we have, but it is an indication that we want members to always be conscious of. As a result, this underfunding affects the kind of programs, the nature of programs, and the extent to which we can actually implement the programs that we are expected to implement. On the second point, Chair, I wanted to indicate that there are findings that the AG has made and comments that AG made against the department. We are working very hard, or the department is working very hard to ensure that those are either changed as per AG's findings or recommendations, or we establish and put into place systems according to how the AG has instructed us to do so. One of those areas is on the issues of consequence management, where the staff is found to have contributed to the irregular expenditure, and we have now made sure that actually consequence management is implemented, and we have made it a point that all our managers understand their different responsibilities when it comes to this particular matter as well. Logis implementation is one of those improvements that were raised the issue was raised by AG, and we had to put the department into the system of Logis, and we think we are progressing quite well, Chair, in relation to that, and that actually assisted as well in the previous findings of the AG that actually had improved from the previous years. I do want to the unemployed doctors. I think members would have seen a number of doctors complaining on the streets that they have not been employed. Chair, it is quite accurate that we have about 200 or so doctors that have not been employed in this in this calendar year, because it's not necessarily the financial year. And it is also correct that the point that has been raised that we have vacancies when it comes to doctors or medical officers. The trick there, Chair, is that while we have vacancies that are there, while we have vacancies that have been funded as well of doctors, but the reality is that we do not currently have the funds to continue with the appointment of the medical officers in those particular vacancies, primarily because our baseline has continued to be cut, and the baseline is cut in a financial year when we already had employed someone in that post. What that means then is that should that post be vacated, we then will not be able to actually complete, or will not be able to fill that particular post if that person is vacated. So I understand that it is something that is not ordinarily understood by colleagues or community members generally, and it's something that we must explain all the time, that yes, it might be a funded post, it might have been a funded post, it might have been a post that had someone there, but the moment that person vacates the post, it becomes a post that we are unable to afford. Of course, Chair, we are continuing to engage with National in relation to these matters so that they are able to assist us moving forward, because that is where our support should actually come in. I must say that the support we have been receiving from the Minister is quite appreciated, and he has contributed, in fact, in ensuring that even in the next financial year, we do get a little bit more than other departments as a health sector, which is something that we appreciate. Of course, that doesn't close the gap that has been opened by the billions of rands that have been taken away from the budget of the Department of Health. So I just thought, let me comment to those few things, Chair, because understanding that these matters are matters that are often discussed at portfolio committee level, but I know that members might have an interest in them. Let me then hand over to the HOD to present the presentation, or to provide the presentation of the department. Thank you, Chair.
Thank you, Honorable MEC, and I must let you know that we are mindful of the financial constraints facing the department. But however, and we have seen evidence of this department not being crybabies, as you say, but taking concrete steps to try and work within the constraints that you are faced with. So that is appreciated, and we would urge you and your team to continue in a similar vein. Thank you.
Thank you very much, Chair.
Let me now hand over to your HOD, MEC.
Honorable Chair, honorable members, and MEC, may I greet you again. I will just show the face and again close my camera. Chair, I'm going to ask that whoever is sharing the agenda take it away so that we try to beam our presentation.
Kabo, can you remove the agenda so that they can beam the presentation?
Yes, Chair. Thank you, Chairperson. I'm hoping that the presentation is visible to the members. May I just check and conclude?
The presentation is visible, HOD?
Yes, Chair. Chair, we've got the members that will add other things. I'm going to try and take the SCOPA through the presentation myself, and when we then take questions from the members, we will assist each other as the team from health. Chair, we are addressing questions that were given to us, and we are going to try as much as possible to be direct in answering those questions. In our answers, if there are follow-ups, we then will try to speak to those follow-up questions that may arise. I'm doing this because at some stage I saw that CFO came in and came out. I would have given CFO to be the one that is presenting, but I'm going to present, then he will assist as and when he's able to be stable. Chair, the first slide that you are seeing now is a slide that speaks to a resolution that the accounting officer report to the committee. Identify and address the root causes of medical legal claims, mitigate its liability in respect of medical legal. So the next slides are speaking to that. The root causes generally, Chair, in our assessment, when you go to court, you find that we are informed that there was suboptimal care of our patients one way or another in the whole conundrum of management of our patients. from home to facility to delivery. I'm saying delivery because most of our cases are obstetrics and gynecology cases. Other cases do come, but most of our cases are ONG cases. Then there's also the issue of loss of or misplacement of patient files, including what we've come to realize that it does happen, the theft of our records by either patients, but also we think our staff does get to be involved one way or another. The other point, Chair, is the very issue of suboptimal management of cases themselves. We're saying now the case when we know that this is a case that may go or is going to court for one or other reason. I think we've said how do we improve on that. The last point, Chair, is the issue of the opportunistic tendencies of some of the legal firms. This we've also confirmed, Chair, to be existing, and we are doing all possible to deal with all these that we've put as the root causes. Among the things that we are doing, Chairperson, is that we have started implementing e-health in our province. We can assure you that in 42 of the facilities, e-health has started to be implemented. However, the challenge of the connectivity still does give us problems from time to time, but we are continuing with our work in terms of digitizing our files so that we do away with the loss or misplacement of the files. Also, there is continuous training of our own staff, because if there is suboptimal care, whether perceived or real, we still need to continue to ensure that there is the courtesy and all the aspects that are clinical in terms of client management. We, however, have developed a 5-pronged strategy that we are going to be using continuously to ensure that, firstly, we prevent cases coming up, new cases. Remember, Chair, most cases that we're having are old cases. Some date back as far before 2010. If cases have happened, we then need to redress, which is something that happens at the facility level immediately after a mishap has happened. But when we realize also that there is a need, or the family or the affected or a person wants to take the case further, and also in our assessment, which we do assess ourselves, whether there was an adverse event or not, whether there was a mishap or not, we then start the issue of mediation. Here, Chair, we are trying to ensure that even if there is a wrong that would have happened, the expenditure on the side of the department is minimized as much as possible, and the assistance required by the affected client is given as soon as possible. That also has another wing, which is the engagement now, either internal or external in the sense that we can engage with the family directly, but when the family starts to say they are involving lawyers, we also take the legal people to also engage with those legal people as well on our behalf. The last one is where we are saying we then take responsibility, full responsibility for rehabilitation, care and treatment. The view we've taken, Chair, is to say whether you are in the private sector or in the public sector, the training is the same. Therefore, it cannot be that we pay high amounts of money into what is called future medical expenses, because that is mostly what we are paying for. We cannot pay for what we are doing now. That sector is available in the public sector. So we are making sure that we are taking responsibility for that rehabilitation, for that care, for that treatment, for the devices and other operations that are clinical for that affected person. So this is the 5-pronged strategy or that we're going to be continuing to make sure that it is employed by our department, and make sure at the same time that we do not give suboptimal care and create more cases. The committee also had observed that there is the impact of the accrued expenditure, and therefore we are supposed to speak to what are we doing relative to that and what.
People who have their mics on, please put them off.
And also we're supposed to answer the question as to what impact the accrued expenditure has had on the working of the department. Now, in answering that, firstly looking at the impact the accrued expenditure has had on the service delivery for 23-24, we are saying the impact was that the department was not able to fill all the posts as planned, which in itself has led to prolonged waiting times and delayed service delivery. MEC has touched on this in terms of our COE budget, which as well MEC has said that it continued to be lowered in terms of our budget, but we've been trying to say, how do we fill some posts? And we took a decision as well to say every post is critical, but we can go into that if needs be. But also in mitigating other mishaps, we've made sure that we implement LOGIS with a view to say that we do not spend beyond what we do not have. And we are continuing to train our staff in terms of implementation of LOGIS and also training our staff on following all the prescripts so that we try to reduce the accruals as much as possible, but work within the available budget. Number two is speaking to the outcome of ongoing discussions with Provincial Treasury. These discussions are ongoing, Chairperson. What we can allude to is the fact that at the end of the day, Provincial Treasury will give us available money depending on the availability of that money in the kitty of the province or Provincial Treasury. There is nowhere where they add more money to what we already have. So what we then to try to do internally is to see how do we become more efficient in utilization of what we have. And we have also started to look at activity-based or zero-based budgeting so that at least we know that everything that we are using is within whatever legal funding that is available. The other issue that we had to look at was the effectiveness of the steps taken to ensure that all invoices are paid within 30 days. Chair, let me start by saying that we have tried to do everything that is possible to pay within 30 days. But if for a time where we have a certain available tranche, we will pay according to that tranche. But if that tranche finishes and Sandile Shabalala and company have not been paid, we then negotiate with Sandile and company to say, we have had this challenge. All I'm saying is we do everything to pay all invoices within 30 days, but where we see that we may not be able to do that, we engage our service providers so that it is recorded that it is not merely negligence on our side for not paying within 30 days or ignorance of the prescripts, but we push as much as possible to pay within the 30 days. The other observation that was made by the committee was for us to speak to the progress made in the determination testing of irregular expenditure as in line with the PFMA and compliance thereof. The linked to that is the issue if the determination testing has been concluded and the progress made in submitting a request for condonation. Now, in our responses, we are saying the department has identified additional internal resources to assist with determination testing. Now, we are saying this, again, going back to the assertion by MEC, that some posts get to be freed when people leave, whatever the reason for attrition. But filling those posts become difficult. Hence, we have looked internally to say what resources, human resources, can we use to try and assist in this function of determination testing internally. But that exercise also is currently ongoing. We are hoping that we are going to finalize it in the financial year 24-25. The other question we had to answer was if disciplinary action has been taken against officials. We can say yes, the department is currently in the process of conducting the determination testing for irregular expenditure. Where people are found guilty, consequence management is done. MEC spoke to that, but we must also state, Chair, it is not always punitive a consequence management, because in some instances we realize capacitation is necessary. Progress made in submitting a request for condonation. Again, I did allude to the fact that we continue to discuss with Provincial Treasury, and in our discussions, we've been advised that some of the documents that or the items that need condonation that date back as far as 2008, 2009, where we've been saying to the Provincial Treasury, it's a historical thing. We do not have documents. They have said it is imperative that the HOD works on that. That write-off is being worked on by the finance team. It will be submitted for consideration and writing off. But where documents have been submitted to Provincial Treasury is working on that. We are waiting on the feedback as soon as they have finished with that aspect of condonation. The other aspect that was looked at by the committee was around the issue of progress made in submitting all outstanding information to Provincial Treasury relative to that condonation, progress made in submitting all remaining irregular expenditure, overall progress made in finalization of condonation, and details of consequence management. Now, it does relate to what I've spoken to. All requested information has been submitted. Progress of consequence management has already started. I've alluded to that. And 2 and 3 are related to 1, which is why we've put it in this fashion, that the progress made and the overall progress for finalization on these condonations is related to 1 above. Then the details of consequence management. In this regard, we are saying we do know of 1 official that has had to be consequently managed, and there was a warning that was given to this official, but also the official is among those that are being capacitated. Further to the above, it should be noted that the determination testing for regular is still in progress, and thus far we will continue with what we need to do with the relevant officials, informed by the results of that determination that is continuing. The other issue that the committee looked at was the issue of having to speak to the issue of unauthorized expenditure, the steps taken to recover any losses, opening of criminal cases where criminal conduct was found, and the measures implemented to prevent future recurrence. The unauthorized expenditure was unavoidable in some of the things that were recorded. I think there we want to speak to the issue of the example I'm going to make, where we are saying there will be a cancer patient that gets to be admitted and a cancer medication mixed for this person at a certain dose. And when that person dies before we to this person, that medication is not going to be used on anybody. But also this applies to anti-venom drugs. So we've got those things that are there that we deal with and are not preventable as such, because statute does do is to reduce our buffer stocks. Here I must say, Chair, we are not going to have a situation where our community is deprived of medication they need, but there is a certain buffer stock that prompts us to procure medicines. That stock we are trying to reduce as much as possible, such that there is no medication that expires in our hands. and that is aimed to make sure that there is no fruitless expenditure, there is no wasteful expenditure that we incur procuring things that end up being wasted because they were not used. On the other hand, we are balancing that with making sure that every client that comes to our facilities gets to be given the medication they need. We, however, have also looked at the very policies and the standard operation procedures we are using to say, if we have to account every time for anti-cancer drugs, anti-venom, somehow we must see how do we make these medicines, some medicines that are within an exclusion list in terms of being looked at as fruitless and wasteful, because we have to have them, and in emergency cases, if we don't have them, we may find ourselves having medical legal cases to look at our eyes if we did not do anything for a patient who would have come. So we're also looking at policies. In essence, we're trying to be as efficient as possible in balancing the available medicines as opposed to flanning the policy. Now, we also are having a situation, Chair, where we pay interest with some municipalities. When we checked, we realized that some municipalities, within 15 days, they start to charge us interest if we've not paid them. And we are continuing to engage these municipalities to say, according to PFMA, of course, they are controlled by MFMA, we are controlled by PFMA, but we engage them to say, can we be able to pay them in 30 days rather than the 15 days they are talking about? So they do fall into that cohort of service providers that we engage from time to time as necessary if there is a need for engagement. But that is a process that is ongoing. In terms of disciplinary action for fruitless and wasteful expenditure, so far, Chair, given the findings that we've had, we have had no official that has been found to be responsible for fruitless and wasteful expenditure, as I've explained why we have found ourselves with fruitless and wasteful expenditure. The next issue to look at is where the accounting officer has to speak to a breakdown of fruitless and wasteful expenditure, the reasons for the delay in resolving the balance of the fruitless and wasteful expenditure, the findings and recommendations of the investigations, and steps taken to implement the recommendations. Now, this is the breakdown, Chairperson. But what I would like to spell there is that it should be noted that the finalization of the cases relating to this does take time, as due to the length of procedures that are involved in following up these cases. The reason for the delay: the remaining cases are currently being processed, and a detailed report will be submitted once once the work has been done, should the committee require us to do so. The findings and recommendations of all investigations and steps taken to implement the recommendations. In terms of the recoveries, we're speaking to what we've said above, but also it should be noted that the determination testing also is still in progress, and as I've said, should officials be found to be implicated, steps will definitely be taken and consequence management will be implemented. The following slides, Chairperson, are speaking to also progress made in the implementation of measures to address the findings of procurement and contract management, then the list of all the transactions above 1 million awarded without inviting competitive bidding, the details of disciplinary action. The following, I think there are 3 or 4 slides that speak to that. I'm going to then go to those slides. The finding by AG was that there was lack of evidence that all contracts were awarded in accordance with legislative requirement. Here, our response was that the department is in the process of digitizing the records and obtaining the scanners to ensure the electronic records are kept. Because if there is lack of evidence, we don't want to be found with the same thing where the AG says they could not find evidence. that is why we are trying as much as possible to scan our files. It's a mammoth task because it's a lot of these paper-based files that we have to scan and keep digitally. Some quotations were not awarded in an economical manner, and the process were not reasonable. We have developed an SOP. This is because when they looked at what we did and the SOP that they looked at, they thought they were not in tandem. So the SOP has been updated to include the market analysis, which informed the basis for the price negotiations. Some goods and services with a transaction value above 1 million were obtained without inviting competitive bidding, and deviations were approved by the accounting officer, although it was practical to invite competition. That is where we say the department observes due process, and where emergency procurement is necessary, processes are then followed. This is where, according to AG, we could have procured following the normal bidding, but in our case, there was need for us to order on an emergency basis. These are differences and discussions that we entered with the AG. Some contracts were awarded to bidders based on evaluation criteria that were not stipulated. I think it speaks to the issue of the SOP, but also the department has trained the staff, and we continue to train them so that we ensure that procedure is followed according to all the prescripts, including our own SOPs. The preference point system was not applied in some instances. This one, Chair, the department has updated its SOP already, and bid committees have been trained on this issue. Lack of evidence that construction contracts were awarded to the contractors who are registered with the CIPD. The department has always been compliant. However, the printout was not done. So we now are changing this. We've now made it mandatory that the registration printout are printed and they are kept on file for audit purposes. The bid documentation and invitation to tender for a procurement of commodities designated for local contents. There are now new regulations that speak to that, and this is no more required. That is how we've handled it. Persons in service of the department who had private business interest. We have our policies, Chairperson, that speak to this. But I think we must say that some of the officials must confirm if they know. But if a person says they don't know, it then becomes a conflict of interest that we discover afterwards. But where we discover before, we do make sure that SOP and policy is followed. But most of the time, this is conflict of interest that is discovered following work that would have been done within the department. Not all service providers would have told us that I am Sbusiso Cele and I'm related to Sandile Shabalala. And without that being informed to us, we will not find until very late when the AG does its own work and finds a relation between these two people. Bid documentation or invitation to tender for procurement of commodities designated for local content. I think that new regulation has been spoken to. Persons in service of the department whose close family members, partners, and associates had private interest in contracts. Here we're saying, Chair, the identified cases have been referred for investigation, and that continues to be done within the department by the ethics committee. And that when that information is found, it is given to the accounting officer, and these people are then made to explain what would have gone wrong in terms of this. If disciplinary measures are required, then disciplinary steps are taken relative to this aspect. A list of transactions above 1 million awarded without inviting competitive bid, where deviations were approved. You may realize, Chair, that it is related to what we've spoken to before, but we'll still give the answers. There is a copy of the deviation register, and it can be supplied to the committee if need be, but it's an annexure that is in existence. Number 3, which is detail of disciplinary action. The identified cases have been referred to the investigating by ethics committee, as I've said. Further, it should be noted that a case was referred for disciplinary action to be taken off the official. The estimated value there was 3,000. But in essence, it speaks to what we do, check and say if there is any disciplinary to be taken, that does get to be done. The other thing we had to speak to was that the committee wanted the accounting officer to speak to the standardization of assessment practices and the effectiveness of these measures. Now, this is a long story, Chair, but we are saying there is a revised audit improvement plan that is being implemented, and it is also available if we are asked to submit it. The audit improvement plan includes activities that relate to verification of data as well as the availability of source documents and files that are necessary. But further to that, special records management and data quality teams have been developed to make sure that this information does not only get to be dealt with when audit comes, but at head office, districts and facility level, this information is dealt with. At facility level, the CEOs are the ones that are supposed to sign off on a monthly basis. In addition to this, the district directors are also required to provide feedback on a weekly basis, but there are meetings that take place bi-weekly to ensure that we are compliant with this and we don't fall back. The effectiveness of these measures will be measured in Q4 with one facility in each district where we're going to do our own audits. The department has seen a huge improvement in terms of the management of this with these weekly meetings that are spoken to and the bi-weekly engagements. Chair, Kotamane, are you able to speak? I'm getting my...
Yes, I should. I'm able to speak.
Yeah, can you speak from this slide?
Thank you, Chair.
CFO?
Yes, apologies, Chair.
Thank you, honorable members. Thank you, MEs. I will take it from slide 30, material findings on performance information. Ideal clinic state. We've been asked to update the committee on the progress made on the implementation of standard operation procedures, and we have developed a standardized guideline with amended easy to follow instructions, and we are confident that the SOPs are complied with, and then we are not going to be incurring the repeat findings in this regard. Move. Okay, on the next slide. Sorry, I just need to take over this. Thanks. Material findings on performance information, provincial hospital service. We've been asked to also update the committee on the progress made, implementing measures intended to address the findings. A virtual platform has been set up by the District Health System Chief Directorates for district to report on the progress fortnightly. We have an M&E system that's been strengthened, and the SOEs are complied with. We have a revised audit improvement plan that has been workshopped with all districts and it's being monitored on a regular basis. The provincial office has conducted 50 facilities visits, and the support visits include controls checking, reconciliation of data, compliance testing, mentoring, and other performance information monitoring. Slide 33. Achievement of planned targets, key service delivery indicators not achieved. That's District Health Services Program 4. We've also been asked to address the committee on how far are we with the implementation after the AG has indicated that we reported only on 49.3% of achievements district health and 36.4% achievement provincial health. Our difficulty comes from that these targets are set in the annual performance plan, not by us, but they are prescribed by National Department of Health. Yes, we have similar priorities and targets, but to conform with what National is looking at might be slightly different here and there. But the continuous improvement, monitoring, and review of information interventions that are designed to develop and implement remedial plans are in place. Strategic planning and performance management repeat finding. The committee wanted to know what improvements have been made and the adequacy and effectiveness thereof in addressing this audit finding. I'll take you through the findings one by one. Information systems not effectively implemented to enable monitoring of progress towards achieving targets. Information was not regularly updated and data not verified when captured. And then we've implemented an audit improvement plan at district and facility level, like I alluded in the previous slides. And the facilities have intensified data verification between source document, summary forms, and the systems. We have supporting evidence that we keep, and these verification tools that have been put in place are standardized throughout all submit facilities. And when they are submitted, the CO has to sign them off on a monthly basis to confirm the validity of data. So there is expected improvement there. Material irregularities, interest on overdue account amounting to 2,009,000. We are waiting for We've been asked to investigate the balance of 640, the findings and recommendations and steps taken towards implementing such, and measures put in place to avoid losses and recover what the department has lost. We are currently awaiting the final invoice. Once that is done, the recovery will be made. If I'm to give background to this 2 million, the department investigated the matter where we incurred interest on overdue account and there was financial loss of 2 million. And then the portion of interest was 1.45 million and were overcharged by 640,000. And the investigation that carried on realized that, and the agreement was reached where we are then going to invoice back and recover the 640,000. Internal control deficiencies, proper document management and records system was found wanting. The department did not implement document management And then we have been requested to put effective interventions and implement as well as quantify the cost incurred thus far of implementing the e-health and then how effective it is. There is a project management plan that's been developed and presented to the department, and it should be noted that all of the above mentioned points have been incorporated into the project management plan. The points in question was the development of a project management plan and establishment of a formal project management practices and standards, and appointment of suitably skilled and experienced persons to manage the project, as well as regular monitoring of the project status, costing, setting of timelines, and putting time frames for full implementation of e-health. So after the implementation of the project management plan and everything else that I've just mentioned in the bullet form has been implemented, I'm glad to say 42 facilities have fully implemented e-health, and phase 2 is in progress and will be finalized in the next financial period, 24-25. So far, up to date, we've incurred 305,250,612 rand 51 cent, and further anticipated cost in the next financial year is 451,992,000. ICT control environment requiring intervention. The committee required the update to address ICT-related audit findings, starting with IT governance, going to security management, user access control, service continuity, program change management, and cybersecurity. On the capacitating the ICT cluster, the recruitment of information and communications technology security manager has been finalized. That should talk to our IT security, access control, cybersecurity. IT security policy will be reviewed, updated in due course, and then we're in the process of procuring the ICT strategy. We're in talks with CETA. Price negotiations are in place. We're also comparing to what's available in the market through the tendering process. That should talk to ICT governance framework and a comprehensive ICT strategy for the department. ICT expenditure on machinery and equipment exceeded the budgeted amount by 100%. We've planned to spend within the budgeted amount in the next financial period. Hence, the price negotiations have been embarked on with entities such as CETA. And then we're testing those prices through the market, through bids, comparing to what's available in the market. ICT Directorate not sufficiently staffed due to the revised ICT organizational structure not being approved. We're currently reviewing the organizational structure. In the interim, post of ICT governance, network engineers, ICT systems developers have been identified, and the recruitment process is ongoing. Digital health strategic plan has been delayed, the implementation thereof. We've made progress in the implementation of e-health as part of digital health, as stated before. Phase 1 is at 88% of implementation. The current digital health strategic plan is finishing in the next financial period. Last one. Medical Legal claims register shared drive continued to be used with an outdated standard operation procedures due to inadequate configuration of Abacus system. We got Abacus back in the years through National Department of Health, and that has been discontinued. Our legal services is currently utilizing an Excel-based in-house developed system, which is being utilized to manage all medical legal claims. Information stored on IT systems is unreliable and complete. I'm on slide 43. Please move. Okay. I'll take the honorable members through. Can you please move to the next slide? Okay, it's fine. Am I audible?
Yes, you are.
Thank you. Information stored on IT system is unreliable and incomplete, and the IT assets register inadequate, and the department not able to accurately account for software assets. We have updated the information for ICT support contact lists, and the department has a complete ICT software assets register now. Slide 44. Investigations. The committee requested that we bring about the nature of, we updated the committee on the nature of allegations, the amounts involved, and the details on details of investigations in progress or those that have been finalized. There's a spreadsheet. Please move to slide 45. Okay. Apologies, members. I'm not going to talk about the paging anymore. I'll just follow through with your permission, Chair. Appended are the nature of the allegations per investigations, the number of cases, and the amount involved as requested. Extortion, 1 case, 20,000. Bribery, 3 cases, 15,000. Then there are the cases that are detailed here that do not lead to quantification of numbers of values as in amounts. Carrying on, HR irregularities or WAPs, 13,307,000. Fruitless and wasteful expenditure, 8.9 million. Theft, 15,505,000. Corruption, 29,180,000. Fraud, 1.8 million. The findings and recommendations of completed investigations. Cases that require internal control improvements were referred to the relevant officials and have been monitored. And then some cases that were referred to the respective civil of institution for implementation of the recommendations are also being monitored. Disciplinary processes that are recommended for all cases where the investigation team has resolved that the officials that were involved in misconduct issues are being followed up and referred to the relevant parties, such as departments, labor relations, for implementation of corrective actions. Slide 48. In respect of cases that have been finalized, the outcome was as follows. 21 officials dismissed, 1 official suspension and a final written warning. 8 of 18 officials resigned during the disciplinary process. 6 officials issued with 3-month suspension without pay and a final written warning. 1 official issued with 2-month suspension without pay and a final written warning. One official given a final written warning, one official resigned during the disciplinary hearing and subsequently arrested, pension payout frozen, so the 800,000 could be recovered from a pension. Anticipated time frame for completion of ongoing investigations and implementation of recommendations. By ongoing, we're talking about those that have already started. We're looking at the end of the financial period. And then further, with regards to implementation of recommendations, we're looking at the first quarter of 24-25 financial period. That's 30 June 2024. Various flood relief initiatives. We're required to address the audit findings on the flood relief projects and adoption of disaster management plan. Slide 50, response to the department, Kandla Hospital, milestone reached, construction started. Prince Mshieni, construction started. Clarewood Hospital, admin building, construction started. Slide 50, please. And the amounts in question are stated. Kandla, 11.6 million. Prince Mshieni, 6.1. Clarewood Hospital, 15.3 million. Site handover, Kandla, September 2023, Mshieni, June, and then Clarewood in progress. Slide 51, RK Khan Hospital waterproofing started, 6.8 million, 16 November 2023. Repairs to nursing residence still at RK Khan, 4.3 million, started October 2023, 88% complete. Phoenix CHC, construction started, 13.9 million, site handover was 31 May 2023, 20% complete. Eddington Hospital Nursing College, construction started, 18.3 million. Site handover was June 2023. It's 80% complete. Slide 52. GJ Crooks, construction started on 15 June 2023, 11.9 million. Wentworth Hospital, construction started November 2023. 20% complete, 20,700,000. Eddington Hospital started 20 November 2023. Design completed 28 Feb 2024, 6.9 million. King Edward VIII award finalized, started 21 July 2023, 8.7 million. Justice Kizenga Mbanza Hospital, tender stage, anticipated to finalize SCM processes 26 January 2024, 9.5 million. Of the 12 projects, total value 120 million started. The department does not have an approved disaster management plan in place. This is a finding coming from the previous audit, but now we have the department has since developed a disaster management plan and it has been approved. Please refer to Annexure B attached. There was 53, 54, 55. Infrastructure projects, Dr. Pixlika Isaga Semi. Practical completion of the project, 2.7 billion achieved in March 2022, commenced in 2005. The project team did not meet the project deliverables more than a year after practical completion. The neonatal unit of the hospital is not yet operational due to lack of human capital resources and shortage of equipment. Response. On neonatal, the Mother and Child Services has not been commissioned. In this regard, 146 million is required to commission these services. It should be noted that the required equipment is now available. Measures taken to complete the defective work and timelines thereof. All major structural and systems defects were completed in May 2023, except for the nest call system, which suffered latent defects after work was completed. And these are being attended to. Commissioning expected this month, March 2024. A total of 32 out of 38 wards have been commissioned. Step taken to implement consequence management against responsible members of the team for not meeting the project deliverables. The delay experience was due to causes that were justifiable, and in such instances, the professional team that failed to pass over construction information to the contractor on time, the money paid to the contractors was recovered from the consultants. So consequence management was put in place accordingly. Infrastructure projects, Makwad Eye Hospital. Committee required us to update it on the steps taken to remedy defective work and to complete the installation of a fire detection system and timelines there. All critical defects have since been attended. Work completed 5 March 2024. King Edward infrastructure projects. Due date were required to apprise the committee of plans and steps taken to remedy the outstanding defective work and to complete the additional repairs as well as timelines for completion of the work. In respect of maternity ward 2, there was not in use. The following should be noted. Ward 2 was first damaged by storm, October 2017, further damaged by storms, April 2022. It could not be used any longer. A capital project to fully refurbish it was initiated in 2023. Once the design has been finalized, a contractor will be appointed through SCM processes, and the appointment of consultant is at SCM awaiting DBEC. In respect of the air conditioner biometric system not being fully functional, the following should be noted. Fire panel. The alarm panel was serviced as functional in April 2023. Next service due April 2024. In respect of 2 faults that were noted, the necessary reviews and action will be implemented. HVAC system. It received a major service and is currently functional. There are few service recommendations for repairs that need to be attended, and those were attended to in Feb 2024. HVAC units and chillers are functional and in operation. Some of the chilled water fan coil units were not functional. These are being addressed, and the entire system is expected to be functional in due course. Ideal clinic realization and maintenance program. The committee required us to apprise it of the steps taken to ensure quality improvement plans implemented by the clinics and are monitored, as well as steps taken to implement consequence management for non-compliance. We've implemented a monitoring and evaluation system to improve compliance. In this regard, the District Director, Deputy Managers, Clinical and Programs report on the progress made in addressing findings at the clinic on every second Wednesday of the month. Further, districts and facilities operational managers have been requested to identify ideal clinic realization and maintenance champion who will be responsible for ensuring that all essential elements that has been lacking are adequately addressed. Furthermore, we've developed an audit improvement plan to address all the gaps relating to the transversal elements in terms of human resources, infrastructure, medical supplies. A 2-day workshop was conducted for the district's ideal clinic realization and maintenance program, and the standard operating procedures was developed and assessments are being conducted. Emergency Medical Services, EMS. The committee resolved that we implement a long-term procurement strategy for ambulancing and prioritize corrective action needed to be taken to deal with delays in response time for ambulance, lack of due care by staff, replacement of equipment, and enforcement of strict control over compliance with policies, regulations, and SOPs, and implementation of consequence management. The resolution of the committee is noted, and then we developed a long-term strategy, and we prioritize budget for the replacement, repairs of ambulance, and monitoring of turnaround time in that regard. Delays in response time and repairing of ambulances. In this regard, the following was taken. Vehicle management service provider has been engaged to increase the pool of service providers. District health officers engage with the office providers, and there is weekly monitoring of vehicle downtime. And then on the next slide, there's 32 new ambulances broken down in these numbers. Thank you, Chair.
Thank you, CFO. And colleagues, as you can see, it has been quite a comprehensive presentation. I am going to hand over to you for your questions and comments, members of SCOPA. But I have one more question, which CFO and HOD I would like you to just also consider. And in terms of payment of invoices, we have been asked by our colleagues in the SIU to ensure that the provincial departments pay their debts. So in terms of the Department of Health, there's Proclamation 23 of 2020, and the amount there is 6.3 million. The department has paid 4.6 million as at 31st January 2024. So there's an outstanding amount of 1.642 million. I'd like to know what's going on there. That's in relation to the National State of Disaster investigation. And I'll just repeat it, Proclamation 23 of 2020. Then we've also got Proclamation R74 of 2022 dealing with medical legal claims. The amount invoiced was 5.457 million. The department has paid 1.4 million. There's an outstanding amount of 4.042 million. I'd like some feedback on that because, whenever issues come up, we are always told that, the province owes entities and departments. And I think it is very embarrassing for us. So I'd like some feedback on that, also in terms of timeframes These figures were given to us as at 31 January 2024. We are now in March. The situation may have changed. I don't know. Colleagues, let me hand over to you. The department has covered the various issues that were raised in the audit report. It includes the investigations and measures taken to deal with unauthorized expenditure, irregular expenditure, fruitless and wasteful expenditure. There were findings on performance information. There were issues around the medical legal claims. I'm just giving you some of the issues that were there. There was the issue of procurement and contract management that had come up as well. And there was the issue of assets that I think had been spoken about as some of the issues that were raised. By show of hands, colleagues, please. I think while I'm waiting for people to raise their hands, etc., I want to also say that we do note, HOD and your team, that you have gone ahead with putting measures in place. For example, the disaster management plan, which was not there, is now there. That's appreciated. Your e-health, but that is taking a bit too long. That's one of the things as SCOPA we have always identified as assisting you. The e-health system will assist you with your medical legal records. It will assist you with revenue collection, etc. But let me hand over to Honorable Kaula. Honorable Kaula.
Thank you very much, Honorable Chairperson, Honorable Members, Honorable MEC, Makutwa, and the HOD, Dr. Shabalala, and your team. Thanks for all these responses. Just a few questions of clarity, Chair. I think there are about 3 or 4. The first one, HOD, is on slide 11 on the issues of irregular expenditure, where the HOD is informing us that the Provincial Treasury has advised that where the department has no documents, it is upon the HOD for Department of Health to approve the write-off. I just want to check the authenticity of this information, Chair. It sounds like to me I wouldn't know why this is the way out, because what it says to me is if I can play the devil's advocate, I can just say, no, my department does not have these documents, and then Treasury will grant me to do the write-offs, and I just do the write-offs. First of all, I want to check its authenticity, but I cannot question Dr. Shabalala because if it is true, then he is not responsible for it. I just want to check if the correctness of it. Thanks. And then slide 17. Slide 17, Chair. Slide 17, Let me pass that one. Maybe I'll come back to it, Chair, because I don't know why I wrote it here.
Honorable Kaula, you want to come
Chair.
back?
No, I'm going to go to slide 23, Chair, because I've lost my issue there on slide 17. I'm going to go to slide 23.
23. All right.
There are 3 blocks there. I'm interested in the third one. Some goods and services with a transaction value of above 1 million were obtained without inviting competitive bids. And the response is the department observes due process, and where emergency procurement is necessary, deviation processes are followed. Now, my take, Chair, is that that response does not respond to the finding. If they can explain that to us, because the response does not respond to what is being said there as a finding.
Okay, Honorable Kaula, I get you. All right.
Slide 25. Slide 25. The same thing, Chair. Slide 25, block 1. Persons in service of the department who had a private or business interest in contract awarded by the department failed to disclose. And the response is the amended SOP now provides that prior to all hours, the officials must confirm. Well, that is the amended SOP. But what we want to know is what has happened, what consequence management to those who were found to have done this before. Now, the response talks to the current issue. We want to know those who are found to have done this before, what steps have been taken on them. And last one, Chair, is slide 48. Slide 48. Slide 48, bullet 3 and the last bullet. In bullet 3, that it says 18 officials resigned during the disciplinary process. Also, the last bullet, it talks to one official who resigned, and steps were taken on this one official. I just want to know, on the other 18, nothing is being said. With regard to this, the last bullet, that one official, something is said about that official. But in respect of bullet 3, those 18 officials, what steps were taken? Just like it has happened to the official who is mentioned in the last bullet. Thanks, Chair.
Thanks, Honorable Kaula, and thanks for raising those issues because they are important, and I can see that you have been following this closely. Thank you very much for that. Before I hand over to the department to respond, I just want to check, is there anybody else who wishes to raise any matters? I'm not seeing any hands, and I don't want to just hand over. If there might be other issues, then they can all get covered, together. Okay, I'm not seeing anyone. So colleagues, let me then hand over to HOD and your team.
Chair, thank you. Chair, let me start with the SIU payments. We definitely did start paying SIU some of the monies they were charging us. But the delay in paying them is informed, Chair, by mostly the fact that in their document, when they come to us to say this is the work we're going to do, they do allude to the fact that if the department wants to be excused from paying, the department should ask from National Treasury to be excused from paying whatever that SIU would have charged us. And we almost every time start that process, but it takes I'm going to say it takes a long time, Chair, running away from saying we've not been responded to by National Treasury in terms of us being excused from these monies. That is why we then started to say, now that we've not been told not to, let us start to pay. It is for that reason that we've had these delays, Chairperson, and we are slowly trying to pay, given also the fact that we prioritize and try to make sure we meet and pay the suppliers, all of them, with whatever kitty that we're having. I think I would like to put it in that fashion, but we're going to follow it up with National Treasury, and the finance team will also confirm whether we given that leeway not to pay. If we're not, we then pay. Essentially, it goes to about 7 million, given the two figures that Chairperson has spoken to. The issue of irregular expenditure and the approval, we did allude, Chair, to the fact that these are documents that go as far back as 2008 and 2009. These are irregular expenditures that we've been found to be having in all the financial years that we've been as part of this administration. And our argument has been that if you find the Department of Health having irregular expenditure, it speaks to prior years where we don't have control of, and we go anywhere trying to get these documents, and we can't find these documents. And informed by such, we then engaged AG, we engaged National Treasury, we engaged Provincial Treasury. So this advice that these can be written off by HOT comes from Treasury after all these engagements where there were disputes to and fro discussions that ended up with them saying they will then check all the recent ones, but these are going to be in the hands of the HOT. Also, we did consult one of the service providers who's doing some work in the internal, in the risk management services as to how we can manage this. So this is how the write-off has come about. It was not an issue of just easily being allowed to do the write-off. So yes, it is authentic. It is something that, if needs be, we can bring proof thereof. Then the non-competitive bids that Honorable Kaula is referring to, there were procurements that we did, and when we did them, we procured following emergency regulations and emergency treasury notes. But when the AG came, they said, no, you could have followed the bidding process. This is where the issue of emergency comes to be defined. And in fact, sometimes the time lag between procuring something on an emergency and the time that AG would say, but this was not an emergency, comes into the picture. So it's that issue of us saying this was an emergency and we procured using emergency processes, but AG would say, no, you should not have used emergency processes. You rather should have followed bidding processes. But the truth we know, bidding processes can take longer than just emergencies. If I may remind the honorable members that at some stage the department headed to court because the unions were saying the department, not only in KwaZulu-Natal, but also in the whole country, the Department of Health was exposing its members to bad conditions relative to COVID because there were no PPEs of this and that, and emergency orders had to be implemented to prevent such going to court, to prevent our own staff dying or getting infected by COVID and other related illnesses. So emergencies were used, but according to AG, there was that discrepancy. I may answer it in that fashion. The private businesses, I did allude, Honorable Chair and Honorable Members, that if a Sbusiso Cele, a relative of Sandile Shabalala, with whom Sandile has not been speaking for 2 years or whatever period of time, comes into tender either in the Department of Health or any other department without the knowledge of Sandile Shabalala, Sandile Shabalala will not know except after the tender has been processed whether he gets it or does not get it. And the only thing we can check with Sandile, the employee of the department, is, were you aware of this? Were you not aware of this? If they were aware, were you involved? Were they not involved? And the ethics committee, which I've said is in my office, will then be able to say what should be done to this official. But most of the time, if an official says, I was not even aware that my cousin who lives in wherever is tendering with the department, there is no punishment or consequence management that can be meted against that official at that level. It becomes a very difficult dice to throw and expect to win. So there are those issues. I think I will want to ask Dr. Mthembu to speak to these differences that allude to the 18 and the disciplinary hearing of the other process of the other one person. The other one we say disciplinary process. The other one is disciplinary hearing. I don't want to cloud it with my initial information, but we will ask Usisnozipo to speak to it. Usisnozipo, through you, Chairperson.
Thanks, HOD. Dr. Mthembu.
Thank you, Chair. Good afternoon, members and HOD, our MEC. I think the issue is around the 18 officials who resigned during disciplinary process. Yes, it happened like that, Chair, especially because these officials are coming from our facilities. When they start to process discipline, and then they can resign. What we usually do as the head office, we will try to stop the process pension so that we can check if we cannot recover. Sometimes it's very difficult because they've got the right to resign because of our institution. But in other instances, we do or we managed to recover through pension payouts. Thank you, Chair.
Maybe, Chair, to just add, you may have noticed the wording. The disciplinary process will start with investigations and everything else. And some of the officials immediately they realize that there are investigations that are going on around them before they are given anything that speaks to them being charged. Then they resign. At that stage, it's difficult to say you can't resign or we're going to hold everything on your side. Besides the fact that you may find that it's a investigation that's happening at that office and the person resigns at the hospital level and the hospital processes everything only to find that when whatever we do, we are then sort of late to try and recover from them if there was anything to be recovered. But if already there is a disciplinary hearing, definitely that person is involved and therefore all the processes, including the issues that relate to GEPF, can be held by the department so that we can recover monies from them. Wanted just to add that part. Chair, I saw CFO's hand also coming up.
CFO.
Thank you, Chair. Mine was to add on Honorable Kaula's question or response by the HOD, where the concern was a write-off by the HOD. And then there's also an issue of determination. The procedure is as follows. If the irregular expenditure has been incurred, it is for the accounting officer to then refer the matter to the Loss Control Committee and also to establish or determine whether there was loss incurred and it was an issue of commission with a result of fraudulent activity or irregular conduct or material irregularity. If the matter requires further investigation and the result of investigation concludes that that matter needs to then be referred to other bodies such as SAPS, I'm making an example, then that needs to be done by such. If it means this matter is an issue of non-following of procedures, but there was no loss incurred by the department. Remember that an irregular expenditure may occur when there is no loss incurred by the department, but there is still payment towards goods and services that were received by the department, and the spend is equivalent to the benefit received by the department. So the departure from procedures may be an act that requires disciplinary hearing. When the accounting officer has no need to recover anything, or there was no loss incurred by the department, and the determination has arrived at the conclusion that there was no fraudulent activity or misconduct, then the accounting officer is able to then write off that particular irregular expenditure so that it can be removed from the record of irregular expenditures. There is a procedure that is supposed to be followed, provided it's not a financial misconduct issue, but is an issue of condonation. In this case, we are referring to condonation of irregular expenditure that occurred back decades ago, and the cost of trying to establish, find, or recreate supporting documents to support such irregular expenditure far outweighs the benefit that may be derived from having such documents. And it's been established that the department did not suffer any loss, but per the report, it falls within the categories of irregular expenditure as defined. It is in such instances that the Treasury refers this back to the HOD in his capacity as the accounting officer of the department to authorize the write-off so it can be removed from our records. Thank you.
Thanks, CFO. Colleagues, are there any other matters that you wish to raise? Thus far, we've just had Honorable Kaula, and whilst you are deciding, Honorable Kaula, are you covered?
Yeah, Chair, can I just come in just one issue?
Okay, fine.
Thank you very much, Chair. Thanks for the responses, Chair. My thinking is back in respect of slide 17. You know, I don't write these things down, Chairperson. I think I'm a big elephant, and sometimes I forget. Slide 17, HOD, it's preceded by slide 16. It talks about wasteful and fruitless expenditure. Your response talks to, it is therefore technically incorrect to classify these as fruitless and wasteful. You see, this response doesn't help us at SCOPA because you are telling us that you are not in agreement with what the HE has said to you. I recall that some 2-3 years ago, Honorable Mchali and myself had an issue with agriculture when they had responses like this, where they are denying the issues that the HE is saying to them. It's the same instance here, Chair, where they are telling us that it's not fruitless, it's not wasteful expenditure. But the HE has told us it's wasteful, it's fruitless and wasteful expenditure. Just wanted to make that comment, Chair. Thanks.
Thanks, Honorable Kaula. Sorry, my apologies, I was shut off. In terms of their response on that matter of the fruitless and wasteful, amongst other items, right? The medicines they're talking about are anti-venom and specialized cancer medicines that end up expiring because they could not be used on any client, right? But at the same time, the department is faced with a situation where they have to have these things in stock. So when they expire, because people haven't, it's a bit, I think, like the COVID medication. It had to be kept for a certain time in certain conditions, and then you couldn't use it after that. It became a waste, right? So I think their argument is that it's not fruitless and wasteful because they have to keep it, but they're also saying that there's going to be a review of the policy, and their procedures will then exclude these types of medication. And I think if that is done, we can agree that all of us would want those medications in stock. I mean, if I'm bitten by a snake, I would want the hospital to have the medication there. But, we don't anticipate, and you don't get that many people bitten by snakes. So the medication could expire. And it doesn't mean that you wasted your time buying it. It's something that's not really predictable. So I think the route of applying for these to be exclusions would make sense. And where you classify and say, this is the reason. Honorable Kaula, would you be comfortable with that?
I'm happy, Chair, with that. Thanks.
Thanks, Honorable Member. I can see the hand of, is this the CFO? Look, there's Honorable Taylor. Let her speak first, and then we'll take the CFO.
No, Chair, I was just wanted to say that you've covered me very well. On top of you wanting to receive this medication when you get to hospital, you want to receive it not to have been expired. So in a way, as much as sometimes we become quite stringent with the way CFOs are expected to respond, we get the point. I think you covered me well, Chair. Thanks.
Thanks, Honorable Taylor. I think CFO, your hand was up. I'm not certain.
Yes, thank you. A quick one. We will stick by our response that it is not technically incorrect because wasteful expenditure is expenditure incurred in vain as defined in the PFMA. Provincial AG is allowed to consult
Honorable
with their
Chair,
technical
can I call an order,
department.
please, from the CFO? Can I call an order? I don't think it's necessary, this response now that he's doing. The chair has supported him. We have supported him. I'm not sure now what is he trying to do.
Yes, CFO, I don't think it's necessary. We all understand the situation. What we would say is that these should be listed as exclusions so that the AG also is clear that, it's unavoidable but has to be done. So I don't think you need to add to that response. Thank you. Colleagues, are there any others of you who wish to raise matters? Okay, it seems like there are no takers. Then let me, in summary, just in thanking the department, say that we must note progress, right? We can see that your disaster plan has been done. We can see that you have tweaked your standard operating procedures, obviously, particularly around procurement and contract management. And we would want to, obviously, the portfolio committee and the chair is here, I think, and welcome to the chair, I think would follow that up to ensure that you're on track. We must compliment you in terms of consequence management because in terms of the action that you've taken, we always cry out that there must be consequence management. I note that there have been 21 dismissals. 18 have resigned in the course of disciplinary hearings. So I think there you would have to chase recovery. And there have been several suspensions. And what I think is really good and sends a clear message is there was one employee who was under disciplinary hearings and who resigned. The pension was frozen so that an amount of 800,000 could be recouped from that pension. Now, we must commend the department on this because this is what sends the message to people that if you do wrong, there are consequences and you're not going to get away scot-free. So thank you very much for that, and we must record our appreciation. Then also in terms of the e-health, right? And this is around record keeping and management. And the refrain has been that the sooner you get onto an electronic record keeping and management system, the better it is for the department. We note that you have rolled out this to 42 facilities in the past financial year. And we also note that in the 24-25 financial year, you are planning on rolling out phase 2. So we must say well done. We note the progress. We'd like it to be faster, but we do understand the constraints, and we would want continuous updating on this. There are certain matters outstanding which we will follow up. And we must also commend you where issues were raised by the AG around your ICT security and other matters. You've now appointed an ICT security manager. So hopefully this person starts ensuring that things are in place. But there are certain outstanding matters, two that I have picked up. There may be more. One is the SIU payments, which we'll want feedback on. And the second one is on the neonatal unit at Pixley, right? The mother and child care facility. I think that one is an important one. And should funds become available, you should ensure that that is up and running, because that is an area where much assistance is required by the communities. But having said all of that, I think I must say that, I can see, the signs that the department is taking the AG findings seriously, is putting in place measures. Hopefully this will result in an improved audit outcome. And we'd like to thank you, MEC, HOD, and your team for the work that you have put in. So thank you very much for that. I don't think we want to keep you any longer because you've covered the key issues. We can now close this meeting. Thank you.
Chair, on a lighter note,
yes.
On a lighter note, we just came back from a debate where Honorable de Klerk was saying this department gets people to get away with murder. I hope he was listening to your
Get away with murder.
Thank you. Get away with murder.
That's a very big statement.
And there's no political management. Did you hear that, de Klerk? I hope he's listening.
Thank
you.
Okay, thanks everyone.
No.
Meeting is closed.
I want to protect Honorable de Klerk.
Thank you, Honorable Chair. Thank you, Honorable members.
I hope there's no snakes around. Bye, everyone.
Siyathokoza, Chair. Thanks.
Uyayizwa English, Honorable Khawula. Isingisi samhlonipha ucela.
Isingisi
Hayibo.
esiphezulu kabi. Get away.
Udlala ngelungu likaHlabisa lona, udlala ngelungu likaHlabisa.